Non-pharmaceutical interventions are tools available to government leaders at all levels to limit the spread of communicable diseases. In this visualization, we attempt to understand how NPIs, non-pharmaceutical interventions, were used in the early stages of COVID-19 epidemics across the US states and the District of Columbia. We layer the implementation of non-pharmaceutical interventions on top of the case and death data from all the states over the past 2 months. By doing so, we allow for easy comparisons between states and to be able to understand at what point in the epidemiological curve did states implement their NPIs. In the top part of this visualization, we can easily see which states are currently experiencing the most cases of cumulative COVID-19 disease. By toggling to a per capita view, we can further understand the severity of COVID-19 occurring within those states at the current time. The heat map below indicates which states have implemented NPIs by placing a square within the cells. The size of each square corresponds to the severity of the outbreak within that state at the time the NPI was implemented. We can also easily see which states have made the decision not to implement particular NPIs. By comparing, for example, the District of Columbia with the state of Idaho, we can see that Idaho implemented its full suite of NPIs much earlier in its COVID-19 outbreak than DC did. When we select a particular district or state, we can also see below when this particular area jurisdiction implemented their NPIs, as well as the severity of the outbreak at that time. We further plot that on an epidemiological curve with log or linear views. The red dashed line represents when the state reached the 2 deaths per million inflection point. This also allows us to understand what the lag time was between implementation of an NPI, such as a shelter-in-place order, and subsequent bending of the curve, which is really difficult to discern for DC, indicating that it may still be actively growing exponentially in cases. In addition to building a tool to compare NPIs across states, we built a complementary tool to understand and to view the NPI implementation data from a different perspective. In this tool, we can similarly toggle between different views and across different dates. If we choose the deaths per capita view, this gives us a very strong sense of what states are struggling to contain the COVID-19 disease and are experiencing severe outbreaks. New York is the obvious outlier, but states like New Jersey, Connecticut, Massachusetts, Michigan, Louisiana, and even the District of Columbia are showing signs of severe COVID-19 disease. Other states in the South, such as Georgia and Mississippi, states in the West, such as Colorado and Nevada, in the Midwest, Illinois and Indiana, and the Mid-Atlantic, Pennsylvania, Maryland, and Delaware, are also showing signs of increased COVID-19 disease. When we switch to a deaths view, we can hover over a particular state and understand after the first death was recorded in the state of New Jersey, on the right we see that it took 7 days before bars and restaurants were closed, and it took 12 days before shelter in place was put into effect. As we scroll across other states, such as West Virginia, which was the last state to report COVID-19 diseases, we notice that West Virginia instituted the full suite of NPIs prior to recording its first death. This gives us an additional view, an additional means of comparing states and understanding which states acted when respective to their epidemiological curve. Below, we can also see that as we hover over these particular numbers, we can easily see which states have yet to implement particular NPIs or which states have decided not to implement particular NPIs. Again, this gives us a means of comparing states and understanding what their current status is with respect to the disease and the NPIs that they implemented. Together, these tools provide us with additional situational awareness to inform leaders at all levels of how their state responded to COVID-19 with respect to their neighbors or with respect to similar states. We hope to inform states about we hope to inform states regarding making decisions on when it might be safe and appropriate to relax NPIs, and to also learn from their neighbors and from states across the country who have relaxed NPIs, and to understand whether or not they experienced a subsequent increase in cases or deaths. It's important to remember that in addition to looking at NPIs layered on top of cases and death data, other data streams such as testing capacity, health systems capacity, and underlying vulnerabilities of the population should be taken into consideration when making decisions about when it might be safe to relax NPIs. These tools are essential to providing the situational awareness that states may need to make decisions and institute policies to protect populations and to protect the integrity of their healthcare systems.